Quiet. Relax. Nice. What a nice segue right to my topic, which I wanted to start this off. That I appreciate the opportunity to come here, okay? Because this is what I do every day. This is my world. I do have a bias that I want to kind of throw out there. You know, I am a product of the St. Paul Public Schools where I work. I'm a parent as well of a 23-year-old son. I'm a school nurse for 17 years. I'm a community member, a union activist. I'm frustrated, but I'm a dreamer. I have a dream that I want to be able to see how we can move forward with this, right? This movement. Little introduction here. I'm going to drive right into it. Martha kind of talked a little bit about it. Our problem is when we go to negotiate contracts, people don't understand what we do. There's research out there, qualitative data that says, through my dissertation, when you ask people what nurses do, they can't tell you. They just say things like, well, they're great. They do a lot. We couldn't do anything without them. When you go to a bargaining session and try to articulate, it doesn't work. Because what happens when you are negotiating, this is my 5th contract for St. Paul Schools for 10 years, it's a money issue. They don't see the values that we talked about, like Terry mentioned, around social justice, right? They're looking at how can we, as a district, have financial responsibilities. So it's our responsibility, right? It's how to spend the money for our kids, right? We know, whether it's related services or teachers or smaller class sizes or manageable workloads, we know what they are. And there's money. St. Paul Public Schools has almost $700 million budget. We have 70 nurses. $92,000 for an FTE, a full-time equivalent. Add it up, someone out there. It's less than $7 million. 1% of our budget is allocated to school nurses. And we have some nurses who have 5 schools. And that's not healthy for the worker and the student and the staff and the family. So I always tell those students you can only be sick on the day the nurse is there, right? Or you can only have an asthmatic attack or anaphylactic reaction, right? When there's a nurse there. Otherwise, the secretary or non-licensed staff, which is a whole other topic we could spend our time on. So we need to have quantitative and qualitative data, right? And we need to kind of have this understanding that school nurses equals healthcare system, right? The difference between myself working every day and a nurse in a hospital or a clinic is my setting. I do the same thing a registered nurse does everywhere. I just happen to be in a school. So we have these complex students that come in on a regular basis, and registered nurses have to be valuable, right? And we talked about it down there, Terry did, and it was mirrored throughout this whole movement from right to left, was coordinating school health is important. All the data that Terry said is important, right? I have 80 parenting girls at my school. The dropout rate, and she'll probably be able to give her a better accurate, but around 80%, right? If you have a child in high school, you might not graduate. So what do we do, right? We're solution driven, right? Our union. We have a daycare at school. Duh. A daycare at school, like we do. And we support the student. That's our goal. Some powerful, the third bullet there from O'Rourke in 2005, long-term outcomes are important. We teach kids younger, so when they move through the educational system, right, when they become adults, they're a healthy worker, right? Last week we had a presenter from the Lowen Institute, maybe, Lowen, Dr. Sani, and he had a great slide. I wish I had it up there, but we only have 12 minutes. The slide was, there's a direct correlation between education and health and productivity and health, right? So it's a no-brainer. We have birth to 3 programs where we teach our families and our students as young as 1 year old, right? All the way through so they can manage their chronic disease, right? They move through the system, they become adults, they work out regularly because they know that asthma's controllable. They have to be on a maintenance. They have to take it when they're supposed to. They know they're going to have exacerbations because they learned from the school nurse or the site-based school clinic. They're fine. They miss no days of work, maybe 1 or 2 when they're an adult. We all have chronic disease around our workers that we work with, together. We're always going to talk about our problem and our concern around poverty. So Fleming had a phenomenal article in 2011, Pacific Northwest, 56,000 students there. The number one driver for problems around health is poverty, period. More kids that go to the school nurse if you're poor than anyone. And actually the discrepancy isn't really an ethnicity issue, that if you are a poor white person versus a non-poor white person, the gap is even wider. It just cleared it up for me, saying we struggle, right, with poverty every day. We can't get to critical thinking if we can't have the basics of Maslow's hierarchy, right? We have to be safe, food, eat on a regular basis. It's a great study. So my goal here is to have a little framework for discussion, right? So these are just my view of these components to what I think is a good plan, and it works swell with you guys, right? Our social justice, how important it is, right? We're responsible to stand up for our students and our families and our staff. We are the voice, right? So at St. Paul Public Schools, when Mary Catherine Ricker, who's standing in the back right there, she just came in, when she was the president, right, we knew what was right because we asked our community, right? What do you want for your students? They told us. And you know what was like overwhelmingly one of the things they wanted? Does anybody know?
Health services?
Yeah, or more specifically,
School nurses?
right, a registered nurse they can access every day because it's a right. It's a right to have access to health care. Not because you're poor, you can have a nurse. Or not because you're fluent or you're gifted and talented. I mean, every student should have the right to access health care by a professional nurse. I love our support staff. They are phenomenal, but they're not nurses. I was at a PSRP conference 2 weeks ago, maybe a month ago, and one lady said she is a nurse, but she's not licensed. She's an EA, educational assistant. And she says every day she's scared to go to work because she has to perform nursing duties. I mean, that is terrible for her, let alone the safety issue, right? Because we stand up for our members at AFT, so our goal is how can we move away from that? Because I think our whole panel here is real big on, we only have one real big goal, right? A nurse in every building where there's kids, period. And then we modify that. And I'm lucky and spoiled because Terry, I have a school-based clinic in my school, and they're phenomenal. And our goal is to work together to lighten my load. And also, I can't do the things a nurse practitioner can do or the health educator, right? So it's great. AFT right now is standing real tough right now. Matter of fact, Sarah's in the back over there. Tamilio, 2 L's and 2 M's, Assistant Director of Government Relations. Right now, as we speak, they're at the Hill right now. She's fighting every day for our kids, right? Senator Tester from Montana, he's right there introducing a new standalone bill. So what we're doing is we're piggybacking on your idea that we're looking at, we remove the ratios, which are fine. Me personally, I don't like ratios or ranges. I like a nurse in every building. However, they're better than nothing. But we're looking at it, we're attacking it from, if you are in a school where your poverty level is high, then you really need a nurse. You do, because we have all the data to support it, right? So it's easy to share the story like Martha did when you have this quantitative and qualitative data that says, this isn't Tom saying it who's a nurse, and remember he's got all these biases and blah, blah, blah. It's this research, right? The research tells us. We had a phenomenal What Every St. Paul Kid Deserves campaign, and we would use that through our contract negotiations. So every time it came up, we said, this is what the community wants. We don't want this. This is what the community wants. Counselors, social workers, everyone. Connecticut just passed a ratio like a month ago, right around 1 for every 750. We do have this benefits, and everything's research-based. Just kind of skim over a few of those for time. But we are an asset and we are an extension of healthcare, like Arnie Duncan says, right? Electronic medical records are better filled out, more efficient. The impact is the key, right? We impact kids and they can learn better. I one time had a student with diabetes who came to my office 25 times in 1 week. Now, sometimes they like to come and visit, and that's great. But he would be off the meter, if anybody's a nurse or if you're not a nurse, but it'd be higher than 600 for your blood sugar. And the 2 more hours later, he'd be 35. Maybe Martha can help me out. 15, 20 years ago, we didn't do a lot with diabetes in schools, right? We were like, we didn't even know if you had diabetes. Then all of a sudden we realized we probably should know who these people are, and as years went on, we started moving through this process of what? Identifying them, maybe just checking their blood pressure, or I'm sorry, their blood sugars. And then we thought, well, maybe we should give insulin, right? Because we're the primary care on site. Because when you're not there, you know what happens to that poor person who's 600? That's ketoacidosis. That's maybe sit here all day because the clerk doesn't know what to do and mom can't come, so for 2 hours, 3 hours, 4 hours, you sit there. But you know what we do at my school? We treat, that student doesn't go home, check ketones, they're normal, we're gonna go ahead and just double the scale, we're gonna check in 2 hours and they're gonna be around 150, I'm like, drink water, get back to class. Next day, they're back on track. They don't go home, they don't go to the ER, they don't get IV for 2 days. Effective and efficient is exactly the study that Aaron talked about. So here's the same data. But this is powerful when I negotiate along with our team. This is why it matters, right? We free up your time to do your job, and they're like, here's my thinking, right? They should bring all this stuff to me. And this on our side and say, this is what we want, Tom, a nurse, a social worker, a counsel, a site-based clinic, because you impact me and make our kids safer, and my time is more valuable. I don't have to do the nurse. So they should be bringing this information to us. I can't figure it out. In my brain, I'm like, this is not that difficult to understand, is it? My dad is 79 years old, been in the union for 58 years. He says, they don't get it? I'm a dumb truck driver. There should be a nurse in every school. The opportunity gap, right? AFT, this is what we do, okay? We don't just stand up here and talk about things like, I mean, we're here for our time right now, but right now we're supporting other things, right? Senator Warren's college affordability proposal, right? We're standing in solidarity with unions and consumers and environmental organizations, you know, to stop fast tracking, right? We don't want unfavored trade agreements. Randy Weingarten, she's taken on huge corporations and fighting for patients before profits, right? So this is nothing new. We're not backing down. We're pushing forward. We're at the legislation right now. So instead of looking and blaming others, right, we have the answer. We're solution driven. You hire a nurse in a school where there's kids. It frees up time for everyone. Healthy students are better learners, and we directly affect the gap, which is smaller.